Good evening. Welcome to another edition of the 411 Talk Zone radio show right here on YouTube. My name is Leon Jones, and I'm getting right back into the scam series. And tonight, I'm going to talk about health insurance fraud. Now, I know a lot of us believe that we need health insurance. I don't disagree with that. Now, I will tell you this though. If you look at health insurance today compared to health insurance back in 2007, 2008, 2009, you have to look at how high the premiums are. I remember back in those days, we had HMOs and PPOs. The only difference is with an HMO, you had to go to a specialist before you can, or you had to go to your primary before you could go to a specialist, and most of your doctors were in the network. Now, for a PPO, it was a little higher, it was out of the network. Now you have all these other programs with high deductibles. Now, the problem with high deductibles is you might get more taken out, you're going to get less taken out of your paycheck. However, if something happens, you're going to end up paying more out of your pocket. Plus, you're going to end up paying for co-pays. Now, am I going to blame everything on Obamacare? No, because a lot of these health insurance providers, they're pretty big, like United Healthcare and Aetna and Blue Cross and Blue Shield. There are a number of big corporations out there who are making a lot of money. Sometimes they double, they triple, they could quadruple people who really need it. Now, there are some people who believe that we should have a government run or Cadillac style system. Well, you can do that over there in a country such as Portugal or maybe Scotland or Sweden because they don't have as many people. And not only that, they don't have as many people coming into this country from other countries. So socialized programs work when there's not a lot of people. But believe you, in order to make socialized medicine work, you have to have the taxpayers who are going to pay the taxes. Somebody's going to pay. Nothing is free. And what I know is when it comes to health insurance, people like me who get it from their employer, because it's a rule that if you have 50 employees or more, you have to supply health insurance. Who made that rule up? That's the government. Why? Because the premium that I pay, yes, it covers me, but it also covers individuals who are not working. And again, I've always said that you need tort reform. Small businesses can get a group plan. You need insurance across state lines. That kind of information. Because I guarantee, and when I talk about healthcare, I'm talking about Medicare, Medicaid, regular healthcare. You get a lot of calls, you get a lot of text messages, you get a lot of emails about the programs out there. The problem is, many of us don't know about the system to even talk about it. We just are told, well, you need health insurance. And I'm going to get into car insurance too. Is that a fraud? I'm not saying insurance is not a necessity. In some instances where you cannot pay a claim out of your pocket, well, the insurance is there to cover you. But my question is, what are you really getting for your insurance? Many of us aren't getting the bang for the buck that we have to put in because you think about it, we're paying high deductibles. We're also looking at having HSAs, and an HSA is only Say you put $1,000 in and you get $10,000 worth of work you have to get done. Well, that's not going to help that much. And because health insurance is so high, people are going to take advantage of you by offering programs that are too good to be true. And this is what I always tell you about the scam series. Let's get into a little bit of share screen here. Let's talk about healthcare fraud. I'm going to post a link at the bottom of my video. And this is healthcare fraud by the FBI. Again, when it comes to healthcare, we need healthcare, but healthcare fraud is not a victimless crime because it affects everyone, businesses, individuals alike, and it causes tens, not thousands, but tens of billions of dollars in losses each year. And again, when you have fraud, it's going to raise healthcare premiums. This is why you see a lot of your premiums increasing every year. And also, not only do premiums rise, fraud exposes you to unnecessary medical procedures and increased taxes. And again, healthcare fraud. I'm not talking about, because I already talked about Medicare and Medicaid. What about healthcare fraud? So this is very important. People like me aren't eligible for Medicare and Medicaid yet, but I do have health care. Now, healthcare fraud can be committed by medical providers, patients, and others who intentionally deceive the healthcare system to receive unlawful benefits or payments. Now, again, agencies such as the FBI are primary agencies, and what they do, they investigate the healthcare fraud for both federal and private insurance programs. And what the FBI does is they partner up with federal, state, and local agencies. And there's also a provision of a healthcare fraud prevention partnership, and also insurance groups such as the National Healthcare Anti-Fraud Association and the National Insurance Crime Bureau, along with insurance investigative units. Now, there are tips that you can utilize to protect yourself. First and foremost, protect your health insurance information. You must treat it like your debit or your credit card. Don't give it to others to use, and be mindful when using it at the doctor's office or pharmacy. Now, they have something, and I have to do some more research in it, called Good RX, where you can save a lot of money. I've seen the commercials, but they look too good to be true. I mean, you have to be in the real world to see what's going on, because television knows how to deceive people into thinking that they're getting a good deal, and they're not getting a good deal. And also with fraud and health insurance, you know it's a scam when they offer free services. And I say that because nothing is free. So you have to beware of free services. So if you're asked to provide your health insurance information for a free service, the service is probably not free, and it could be fraudulently charged to your insurance company. And regularly check your EOB. Now, your EOB is an explanation of benefits. Now, of course, each year you have to renew your benefits. And when you're renewing or you're checking your benefits on a regular basis, you have to make sure that the dates, locations, and services billed match what you actually receive. So if there's a concern, contact your health insurance provider. Now, who are some of the providers out there? You have Aetna, you have Blue Cross and Blue Shield, you have United. There are numerous insurance companies out there, and they're all looking to take your money. Now, as we get into fraud, there are common types of healthcare fraud. You have first and foremost fraud committed by medical providers, and one of them is double billing. And what that is when multiple claims are submitted for the same service. Multiple claims are submitted for the same service. That's what we call double billing. Then we have phantom billing. That is billing for a visit or supplies the patient never received. Now, that's a pretty big one because this is where you have to get skeptical when you get all these phone calls because phantom billing is a very deceptive procedure. And this is why I always tell individuals watch your emails, watch your phone, watch your text messages. Don't click on any links because you're going to have people that are going to take your information. They could use your information and provide it to somebody else as well. And when they do that, you're not going to get any services. They might tell you you're going to get some services if you give up your information, but that information that you've given up is going to be used for themselves or somebody else off of your back. Then you have unbundling. That's basically unbundling is almost, if you think about it, the only difference between double billing and unbundling, it's just a matter of two words. Again, when you deal with double billing, you're submitting multiple claims for the same service for double billing. Now, for unbundling, however, you are submitting multiple bills for the same service. So some people might get those twisted. Double billing deals with claims. Unbundling deals with multiple bills. And also upcoding. Upcoding is a tricky scam because it's basically when you bill for a more expensive service than the patient actually received. Now, if you think about that, there are a number of big companies out here who are in the insurance business. Insurance is a billion-dollar business. But what about fraud committed by patients and other individuals? Well, that also happens because you have what we call bogus marketing. And that is when you convince people to provide their health insurance, identification number, and other personal information to bill for non-rendered services. They can steal identities. And basically, once they get you in the identity theft or they steal your identity, they're going to sell your information to somebody else. And also, what's going to happen too, you may be enrolled in a fake benefit plan. And then I just mentioned it, identity theft, identity swapping, using another person's health insurance or allowing another person to use your insurance. And then you have, and this is where you get the calls, the impersonation of a healthcare professional, and that's providing or billing for health services or equipment without a license. Again, I'm going to keep this information up. It's going to be under the comment section. I suggest you read it because it's very important. Because then you get the biggest one we talk about is prescriptions, fraud involving prescriptions. And I did a video, I believe it was last week, on how individuals can take prescriptions and put different labels on them. Well, that's what forgery is. It's creating or using forged prescriptions. to sell, to make money. Diversion, it's diverting legal prescriptions for illegal uses, such as selling your prescription medication. See a lot of that going on. And then there's doctor shopping, and that's visiting multiple providers to get prescriptions for controlled substances or getting prescriptions from medical offices that engage in unethical practices. Just like I talk about the law field, the medical field has a lot of scams going on it as well. Because, with this new health insurance, since 2010, doctors believe they're not getting paid like they used to. And one of the things that we need to talk about are prescription medication abuses. And again, that's basically creating or using forged medications or prescriptions. That is a crime. And prescription fraud comes at an enormous cost to hospitals, insurers, taxpayers, and physicians. But the greatest cost is a human one. Tens of thousands of lives are lost to addiction each year. So, got to protect yourself and your loved ones by following this guidance. You're taking opioids right now. Take them exactly as prescribed by your doctor, ideally for the shortest amount of time possible. Never share your medication with others. Explore non-opioid options or opioid options with your doctor. Explore non-opioid options with your doctor. Learn more about the risk of opioid use from the CDC. And if you have unused or expired pain medications, take them to a DEA approved take back site or disposal. Now, again, you've seen all kinds of scams. Just went over. There's fraud committed by medical providers, double billing, phantom billing, unbundling, upcoding. Then you have fraud committed by other individuals with marketing, ID theft, and impersonating a health professional. And then you have prescription fraud, and that involves forgery, diversion, doctor shopping, because what you're doing, you can take a bottle and put a label on it, and that label says it's illegal, we'll put an illegal substance in that container. Or you could take that container of legal substances and sell it for something that's going to be unethical, like pain relievers. A lot of people get addicted to them, make a lot of money. And that's usually taking legal prescriptions and selling them for illegal uses. And of course, the doctor shopping. Now, what I'm going to do, I'm going to really give you some insight on what the fraud is. And what I'm going to do, I'm going to share my screen so you know exactly what I'm talking about. Because it's very important that you really understand. And here we go. This video is going to be a little lengthy, but this is the biggest medical insurance scam.
It's called
fair use.
Prior authorization. Here's how it works. Before your doctor provides a treatment, your insurance requires them to prove it's necessary. This is often a time-consuming process that can cause dangerous delays.
I'm sorry, your cancer could be cured, but we need to wait for the insurance company to approve your chemotherapy.
If you've ever dealt with insurance, you know the frustration of navigating the prior authorization process. It's a bureaucratic nightmare that often leaves patients waiting for crucial treatments, for surgeries, and even medications. prior authorization is a process which health insurance companies require pre-approval for clinical treatments or services before covering their costs. This prior authorization process is supposed to ensure that patients receive the appropriate, evidence-based, and cost-effective care. But in reality, it's become a barrier to access driven by profit motives rather than patient needs. In this video, we're going to talk about that. What's up, everyone? I'm Dr. Antonio Webb, a board-certified orthopedic spine surgeon here in San Antonio, Texas. I've been in practice for almost 5 years, and throughout these years, I've seen firsthand how this prior authorization process is broken and extremely time-consuming. And it's just not in spine surgery, it's across all disciplines and specialties. This also includes simple things like medications that we tend to order. For example, when a patient goes to the pharmacy to fill a prescription, they are often told by the insurance that they won't pay for the medication unless a physician obtains approval. Patients may wait days, weeks, or even months for a necessary treatment or medical procedure to be scheduled because physicians need to first obtain authorization from the insurance company. This tactic, used by insurance companies to control costs, is called prior authorization. Studies have shown that the number of prior authorization requests has skyrocketed in recent years, leading to delays in patient care and increased administrative burden for healthcare providers such as myself. Behind the scenes, insurance companies, they have this complex algorithms and opaque criteria to determine whether a treatment or medication will be approved. And all too often, these decisions are really influenced by financial considerations rather than medical necessity. Sometimes these procedures, these treatments and medications are recommended. Really, the thing responsible for that denial is a bot or AI system. United Healthcare, they're one of the largest healthcare insurance companies in the US, and they were recently sued for allegedly using an AI algorithm to override doctors' judgments and wrongfully deny critical health coverage to elderly patients. What's even more disturbing is that it was said that this AI model that they're using has a greater than 90% error rate. And the sad part is United Healthcare continues to use this flawed AI model because so few patients typically appeal any of their healthcare insurance denials. When a physician is actually assigned to your case for approval, that doctor who is responsible for giving the approval may not even be in your specialty. As a spine surgeon, I've spoken to pediatricians, internal medicine doctors, GI doctors, just random doctors about my surgery approvals. It's crazy because when I spoke to the pediatrician about a particular case, she had really no idea about the type of surgery that I was asking to be performed, and my surgery was denied. And really, I had to tell the patient there was not much that I could do at that point. Another particular patient that I can remember in the recent months that I had to deal with insurance and authorization was a patient that I planned a staged or two-part operation. This means I stage the operation, I do one part of the surgery on one day, and I do the second part of the surgery on a separate day to prevent a really long operation because this patient had a prior surgery, they had a fusion that didn't fuse, essentially failed back syndrome, failed back surgery, and I had to correct the problem. So I was able to do the front part of the surgery. I went to this gentleman's belly, his abdomen to do an A-lift or fuse from the front. I had to pull out some hardware that wasn't fused and I pulled it out from the front and he did well. Ultimately, I ended up getting COVID. I had to stay at home for about a week, and this patient, I didn't want him sitting around in the hospital, so I sent him home. And after coming back to work, I asked the insurance company to change the date so that I can complete his operation, the second part, which is the posterior aspect of the surgery. And come to find out, they denied that part of the surgery. And I was really confused about this because the insurance company gave me approval for both surgeries before I even started. And when I had to change the date, they denied his surgery saying that he needed to go to physical therapy. Usually when this happens, I get on the phone, do an appeal, talk to the surgeon that works for the insurance company, and unfortunately, still didn't work. I talked to the surgeon. He said that the insurance company wanted this patient to go to physical therapy, even though I completed one part of his operation already, which just blew my mind. So having patients get denied surgeries for things that we're trying to do as surgeons, and most of the times it's either an AI bot or a physician that's not even within your specialty.
Now, what he's just saying is technology and bureaucracy is dictating on what he can really do about his practice. Now, I always say this when it comes to profit. Some of these individuals who work at insurance companies, they're not doctors. They're not doctors, so they don't understand the procedures. And this is going down the road to where insurance is going to continue to deny some operations. And I really believe that it could be an effect to where they want to decrease the population, where insurance is going to say, well, we can't do this. It's too expensive. But yet we're paying a lot for our premiums. Now, again, you have some people that want government insurance. And I'm just going to tell you this. Any type of insurance, if it's done unethically or incorrectly, and people are just using it to make money, they don't care about the patients, you're not going to get the quality of service, and the patient might end up checking out. But when you are looking into insurance, really look at what kind of benefit are you going to get. And if you really want to stay out of the bureaucracy of insurance, take care of yourself when you're younger. Go get your regular checkups. Don't get yourself into a bind where you're smoking, you have substance problems, because what's going to happen when you get in your 40s, 50s, 60s, that's when everything starts to come apart. And that's natural because due to aging, bones get a little brittle. You're not as some people aren't as active as they were when they were younger. Some people just let themselves go. But the bottom line, when you deal with insurance, insurance has to approve everything. I mean, I can remember going to the dentist. Now, my dental plan was you only get $1,200 for a dental plan. And I can remember getting my teeth cleaned. My dental plan wouldn't even approve all of it. I had enough on that. So I had to go into my health savings account to use some of the money for that dental plan. Bottom line is, I'm paying for insurance and I'm getting the benefit for what I'm paying for. Fair use. Let's continue.
And the big problem is that this is not just specific to my specialty. More than 1 in 5 cancer patients report not getting care recommended by their doctor because of these delays or denials. And that's a big problem.
New York Times Opinion interviewed more than 50 doctors and patients. Their experiences suggest that insurance companies often weaponize this mundane process in order to control doctors and inflate their profits.
If they deny care or they delay care, that's money the insurance company gets to keep.
The way that they profit is to deny care.
As prior authorization has spread, delays in care have become normalized. So have tragedies. 1 in 3 doctors say that it's caused a serious medical issue or even the death of one of their patients.
Don't miss the $350,000 big deal reveal, only at Golden Nugget Danville.
If you're lucky enough to live in one of just 2 states, Washington and or New Jersey, you are protected from these delays. If you live elsewhere, you might not be. More states and the federal government need to follow Washington and New Jersey's lead because both patients and clinicians are being actively harmed by insurance companies using prior authorization to put up barriers for this much needed care. We all know that this whole prior authorization process is costly, inefficient, and responsible for patient care delays. It's time to hold insurance companies accountable for their role in perpetrating this broken system. Patients deserve better. They deserve timely access to the care that they need without the unnecessary obstacles standing in their way. So if you're a patient or even a provider, this is what you can do to address and mitigate these challenges. The first thing you should do is understand and learn about the prior authorization process. You want to familiarize yourself with the insurance company, their prior authorization requirements, procedures, and timelines. This includes understanding which services or medications require prior authorization, how to submit requests, and the expected turnaround for approval.
That is true, what he said, but you also have to look at your health history. And to me, you should be able to get insurance based on what you need. Some people don't need a high deductible. Some people do. The bottom line is the marketplace should be a little bit more competitive and see what these insurance companies do. You just heard the doctor mention that when it comes to making profit, what insurance companies get to keep the money even when they basically deny coverage. And this is why you have to keep yourself healthy so you can avoid going to the doctor. That's another way to do it. Now, of course, they used to have a penalty where if you didn't have health insurance, you get penalized on your taxes. I don't know if that's still around or not, but I thought that was about as ludicrous as it could come. I always say health insurance is a privilege, not a right. Now, some people might believe it's a right because they've been told by the government officials. In fact, what should happen is people like me, are working people who are paying the taxes, we should get the same type of health care that our politicians get. Politicians don't have to wait in line for their health care because it's already paid for them, of course, by us. But, many people really don't understand how the health system works. And that's why it is a scam in a lot of instances, because many of us, like me, I got in the mail this evening. This is my Anthem card. Okay, I already know what's on it, and I got my dental cards. Well, the bottom line is, with what you pay for and what you get, the cost really outweigh the benefits. So for me, where I'm helped out is I'm a veteran, so I go to the VA for a lot of my healthcare issues, and I get free health insurance from the VA. Now, I paid in to the tax system, so some people might say, well, you're getting help. Well, I also fought for my country, and I'm also a taxpayer. I've never leaned on the system to give me anything. But there are times that you have to get a gift once in a while and utilize it. The bottom line is these private insurance companies, they're there for one thing. They're not there for you. They're there to make a profit. And they're going to use all kinds of tactics. You just heard the doctor mention AI. You just heard the doctor mention bots. Well, technology is not flawless. There are mistakes with it because technology is developed by human beings. And unfortunately, we have some of the elitists in this country who are very, very greedy, and they really want to decrease the population so they can benefit. Because the more people who are your worker bees out there, the more they got to deal with, and their power is threatened. And this is why they want to make more regulations. However, when you're knowledgeable of what's going on, especially with your health, you can keep costs down. Fair use, let's continue.
Secondly, documentation, very important. You have to document medical necessity. And what does this mean? Well, providers, we play a huge and crucial role in documenting the medical necessity of the requested service or treatment. Your physician should ensure that all relevant clinical information, including the patient's history, symptoms, diagnostic tests, and treatment plans, are accurately documented and submitted with the prior authorization request. If you have clear and very thorough documentation, this can really strengthen your case for approval. You should also communicate. You want to communicate with your insurance company. Providers, we can proactively communicate with the insurance companies to really expedite this prior authorization process and address any questions or concerns. This may involve contacting the insurance company's utilization management departments, discussing the clinical rationale for the requested service, and providing any additional information that they may need. And you have to understand, this is very important. In cases where prior authorization requests are denied, you as a patient or even providers, we have the right to appeal their decision. Providers should review the denial letter carefully, identify the reason for the denial, and gather any additional supporting documentation or evidence to strengthen the appeal. And this is where they're really banking on you not to do, because a lot of people, they just don't know that they can appeal a denial or just don't do it. By taking proactive steps to understand this prior authorization process, communicate effectively with insurance companies, advocate for medical necessity, appeal denials when necessary, and utilize available resources and support services, patients and providers can work together to address this prior authorization issues and really ensure that patients receive timely access to necessary medical care. I'm Dr. Webb. Thank you for watching. Please like and subscribe. I'd like to hear from you guys also in regards to any of your experiences with insurance denials and authorization. Put it in the comments below. I would love to hear from you.
And what I'm going to do, let me get into another video for you, fair use on why medical insurance is a scam. Fair use, fair use.
I'm Mark Cantor from Cantor Injury Law, and I want to talk to you about institutional fraud and corruption in the United States of America. And I've given you some examples in the past, the main one being workers' compensation, which is a conspiracy between the government and large insurers, employers to not pay injured workers. There's another big one that's out there, and that is the entire medical system. And I'm going to explain why and how and what to do about it. So the classic example is someone that gets hurt or sick, and they go to a hospital, and they get this outrageous medical bill, let's call it $250,000, and the insurance company comes in, and they have a negotiated price, and they pay, let's say, $20,000 in total to resolve the $250,000 debt. And they say that that was their negotiated agreement with the insurance company. The insurance company gets a write-off, they pay the 20 grand, and that's it. What happens if you don't have health insurance? Then that $250,000 bill goes in its entirety to collection without discount, and you owe it, and it destroys people. And the problem with that is that the bill is a fraud, Because why is it that they'll take 20 grand from the insurance company? And I know the reason, there's gonna be a lot of comments, but for the most part, it's a fraud because the prices are wrong. What a law firm like Cantor Injury Law can do for you after an accident is negotiate those bills down as if you had insurance. And we do that after the case, and we do it all the time. And what that does for you is it maximizes the amount of money that you put in your pocket so that you can get the big bucks. Because what you're interested in isn't your lawyer making money, and it's not the hospital making money, it's in you making money, getting the money that you deserve for your harms and your losses, and not having to pay back this fraudulent system of the medical system in the United States. It's just out of whack. And you've all heard examples of it where, you know, a simple procedure or even an aspirin where they charge, you know, $50 for the aspirin. Crazy. So if you have a real and serious injury case, we can help you in a multitude of ways. We can get you the medical care that you need. And there's something called the billed versus paid analysis. And that's what happens in Missouri. In front of a jury, we get to show the jury the billed amount or the owed amount. And the defense, insurance company, we don't get to say to the jury that it's an insurance company, but the defense gets to show the paid amount, the amount paid to satisfy that bill. So we ask health insurance not to pay because we want that entire $250,000 bill being either billed or owed, but not paid, because if it comes in at $250,000, that's what the jury gets to anchor to. But if it comes in at $20,000, the defense argues that the value of the care received was only $20,000. So don't do that. Get a lawyer that's local, that knows the local rules. And there's a lot of lawyers advertising. Many of them don't know this. They're not from Missouri. They're pretending to be here because they're on TV, but they're not. Cantor Injury Law is right here in Creve Coeur. We have multiple locations. You've seen us. We're on buses and billboards and TV, but in reality, we're right here. I'm Mark Cantor. If you need help, please call us at 314-628-9999, and we will get you the big bucks. Thanks for watching.
Now that was an attorney, and you know how I feel about attorneys. You need attorneys, but I'm gonna get into some of them with their profession because they're tied up in this loophole with some of these medical companies as well, because they're making big bucks. You see, when it comes to America, and you got to go back and look at that video I did on, is America a dream or is it a scheme? Well, you think about it, most of what's in America is all a scheme. It's to give you the illusion that you've made it, but you really haven't made it. See, the people who make it, doesn't matter who you vote for, you're still going to have your same lifestyle because you're going to have that influence in elections. And when it comes to health insurance, the elite, they don't care about health insurance for me. Why? Because they can buy it. They have the resources. See, when you don't have the resources, you have to depend on a United Healthcare, an Aetna, or Blue Cross and Blue Shield. But other than that, I just want to say this. You need to understand the healthcare laws, and you need to understand what's going on in your state too. A lot of people don't even know what's going on in their state, and they don't care about what's going on in their state. Let me stop share for a moment. But when it comes to healthcare, now, is it all bad? No, but there is some fraud with the healthcare system. In fact, and everything that's going on now, even college, told to go to college. It's a scam. And see, when everything gets to be about money, and even YouTube, I'm just going to say this about YouTube, and I'm going off tangent a little bit. YouTube's a scam. And all these individuals trying to make money up here, but what happens to their content? It goes, crashes and burns. And see, I'm not up here for the money because I'm not going to I'm not going to downgrade myself just for a little bit of change. No, I'm going to keep my content the way it is. Because in the long run, the smart people, they're going to see who you really are. Bottom line, what I'm teaching you is how to avoid these scams, because this is what goes on in the real world. So in the end, medical, just like everything else. Not saying it's not important. Medical is important. But what takes the integrity out of the medical profession is what goes on behind the scenes. The government, the healthcare providers, and even some of the individuals that are providing medical care. Because in the end, bottom line, healthcare fraud is not about you. It's about the money. And that's part of the scheme that always says you can live the American dream. But in reality, you're living in an American scheme. Healthcare, just like everything else, in the end, they're about making profit. And once they get it from you, they don't need you anymore. They go to the next person. See, the elite are always going to keep themselves elite. They're going to use the downtrodden. That's why they want to keep the worker bees ignorant. Because the worker bees are always going to depend on these big corporations and a bureaucracy for well-being. Now, all I'm going to tell you is this. You really better wake up. Because in the end, America is all about the money. Healthcare is an industry that rakes in billions. These insurance companies, they don't care about your premium. All they want is what they can charge you. They can deny you health care and they still keep the money. Because in the end, and I like capitalism, but the healthcare system, they utilize bureaucracy, which then equals crony capitalism. Again, I'm going to repeat myself. Medical is just another scam. The insurance is just another scam. Because in reality, it's all about the money. And if you don't believe me, check it out for yourself. But in the meantime, that is my commentary for this edition of the 411 Talk Zone radio show. If you like what I just presented, please comment, share, and subscribe. And if you're looking for some STEM content, check out the QCIS channel. On that channel, I give you a daily dose of science, technology, engineering, and math. And once I record all of my videos, those videos will be posted on my Twitter page. And for the QCIS channel, since it's an educational channel, and I'll be doing a video tomorrow, check that out on my other channel. The QCIS channel videos will be posted on my LinkedIn page. And in the end, be blessed for what you have. Don't worry about what you don't have. Always know that the sun rises in the east, it sets in the west. If it doesn't apply, let it fly. But if the shoe fits, wear it. If you don't like the shoe, change it. Once again, thank you for listening to this edition of the 11 Talk Zone radio show right here on YouTube. Till next time, my name is Leon Jones. Want you all to have a wonderful and gracious evening. God bless you. I'm out.